I'm honored to participate in this important event and important conference being co-hosted and co-organized by various schools at NUST. Given that this specific conference, the second international conference on business management and social sciences, and the international conference on well-being, offering an interdisciplinary perspective, has a focus on organizational and individual workplace well-being. So I thought that maybe I should offer a few words on the topic of well-being. So I don't know whether I said this or not, but once again, Bismillahirrahmanirrahim, Assalamu alaikum, and good morning, ladies and gentlemen. So the focus here of my talk is well-being and the workplace well-being. I would be offering some Western perspectives. I would be offering some Eastern perspectives, and I would leave the buffet to you to make a choice and perhaps identify possible applications in our workplace context. So first of all, let's very quickly start with my understanding of the notion of well-being. The way I look at well-being, ladies and gentlemen, it's a composite measure comprising many different dimensions of how good we as individuals feel at the physical, mental, and social level. Now, surely in a Western context, traditionally the focus is on physical well-being and on mental well-being and on social well-being. In some cases, there is also an emphasis on financial well-being, which is also tied with physical well-being. But in the Eastern context, I'm sure that many of you would appreciate that in addition to these dimensions of well-being, there is also an additional dimension of well-being, which is spiritual well-being. So that is also something which we may consider, that look, in addition to the physical and the social and the financial and the mental dimensions of well-being, spiritual dimension of well-being may also be considered in the way we conceptualize well-being, whether at work or outside work. Now, WHO, the World Health Organization, offers a very interesting perspective on health. And within that perspective on health, they offer a definition which also incorporates well-being. So for example, according to WHO, health is a state of complete physical, mental, and social well-being. So once again, you see that the way at the WHO level, health is being defined, it comprises once again these three dimensions: the physical well-being and the mental well-being, and the social well-being. So if we were to situate in this concept or this construct within the context of workplace, then ladies and gentlemen, we may refer to the ILO's definition, that how does ILO define workplace well-being. And according to ILO, the International Labour Organization, workplace well-being pertains to all dimensions of working life, from the quality and safety of the physical environment to how workers feel about their work, which is more to do with emotional, psychological well-being. The first was physical environment, so that was physical well-being. Their work environment, maybe social well-being, the climate at work, and the work organization. So once again, you see that the way WHO, the way ILO, they are focusing on well-being. Once again, there is a focus on the physical dimension of well-being, the social dimension of well-being, and the psychological dimension of well-being. So that is another perspective. Now, why exactly is this topic relevant in the context of workplace or in the context of wider societies? We have got some data. And much of that data, as we know, the census data, the survey data, in terms of reliability, it comes either from Europe or it comes from the US. So I've got some US empirics with me, which would also then give us a proxy of the situation or the extent of situation that we are facing in South Asia and other parts of the world. So for example, based on the US data, US surveys between 2007 and 17, like over a duration of 10 years, the percentage of medical claims associated with behavioral health, which includes mental health, more than doubled. So for example, in 2007, for example, if there were 100 claims being submitted in 2017, those 100, the number of 100 had become 200, or 1,000 had become 2,000. So that is one perspective. It shows the extent of the problem that we as a human society, we as formal organizations are facing. Now, National Center for Health Statistics, once again, it notes a suicide rate increase of around 35% between 1999 and 2018. So over a course of, once again, 19 years or 20 years, with the rate of growing, with the rate growing approximately 2% a year since 2006. Once again, it's a major concern that people are depressed to the level, they are stressed to the level, their work and life are imbalanced to the level that they are simply terminating their lives. And then there is another data point which says that the Health Care Cost Institute's, its 2018 report, it disclosed that per person spending on mental health admissions increased 33% over the course of 4 years between 2014 and 18. So something is off. As they say in Urdu, एहसास मुरव्वत को कुचल देते हैं आलात. It seems that something is off. एहसास मुरव्वत is being suppressed. Maybe our humanity is being suppressed. Something is off in our universities. Something is off in our government. Something is off in our societies. Something is off in our churches and mosques. Something is off in our workplaces. So this means that there is an issue which has to be fixed at multiple levels. So no single entity, or no single organization, or no single administrator is responsible for this. All of us are contributing to this unfortunate mess, and therefore all of us have to take the collective responsibility in order to first identify the problem, the root causes of the problem, and then make an attempt, a concerted attempt to fix it. So these were the empirics, ladies and gentlemen, which I wanted to share with you. But now let's go to the possible resolution that, look, all of this mess in terms of, for example, the increased depression, the increased separation rates in marriages, the increased workplace conflicts, the increased ethnic conflicts, gender conflicts, and you name it. How we can fix. So you see that once again, as I said, as I promised right at the onset, that look, we can make use of not only Western wisdom, but also we can make use of the Eastern wisdom. So let me take you to the South Isle, if I use that word, to the land down under, or in the proximity of land down under. Let me take you to the Maori wisdom from New Zealand, that how, for example, Maoris, they look at the issue of work-life balance, and what exactly do they suggest that how we can, or the modern society, the human society, wherever we are, we can address those issues. And they offer a model which is pretty interesting. They offer a model of a house. They say that, look, in order to put this house in order, we have to conceptualize the well-being as a house which has various components. So let me very quickly share with you their perspective of well-being. For them, there would be two roofs of the house if we consider that the roof is more triangular shapes, and one would be the mental and emotional well-being, and the other would be spiritual well-being. So this means that we cannot really conceptualize a notion of well-being unless there is a focus on not only on mental and emotional well-being, but also we have to consider the spiritual dimension of well-being. So they think that these are the two major elements of a roof. And then two side walls. For two side walls, they indicate physical well-being and family and social well-being. And this is pretty interesting that they're referring to social well-being, and all of us know that an important, rather most important part of social well-being is family well-being. So this means that we as workplaces, we have to make sure that work and life of our individual employees and managers, they are balanced. Because unless they are balanced, they would not be able to attain family well-being and social well-being. So that is also important. And for the land, and you see that those Maoris and those Aboriginal people and indigenous people, wherever they are very much connected to land. So here we are talking about the roof, we are talking about the two side walls, but at the same time, they say that land is also important. And for land, they talk about roots. So the way I interpret land is financial well-being, that like particularly in these days, we need to have resources. And those resources could be acquisition of land. Those could be, for example, to be able to earn a decent amount of money, decent amount of livelihood to support ourselves and our family members. So resources, which may be seen as a proxy for financial well-being, or at least that is how I look at it, ladies and gentlemen, or that would be my interpretation of the Maori wisdom. Now, let me share with you another important data point. Look, I shared with you the data point from the US. I shared with you the wisdom from New Zealand. Now let me take you to the UK. And a very interesting survey was conducted by CIPD, which is Chartered Institute of Personnel and Development, only last year. It's a very recent survey, 2021 survey conducted by CIPD. And CIPD collected responses from professionals and senior human resource leaders in the UK, and in total 668 people responded in their survey. And the focus of the survey was on well-being. And basically, the CIPD people, they wanted to look at how do organizations vary in their approaches to well-being, in their understanding of, but more than understanding of, how they approach well-being. So they compared the public sector with the private sector and also with the non-profit sector. Very, very quickly, I can share the data with you. So for example, one data point was that, look, in terms of employee well-being is on senior leaders' agendas, only 68% of the private sector said that, yes, it is on the senior leaders' agenda. In a very good news, a relatively good news, 83% of the public sector and 82% of the non-profit sector, they said that it was on senior leaders' agenda. So this means, ladies and gentlemen, that those people, whether they are in public sector or private sector or non-profit sector, their senior leaders, their CEOs, CFOs, CEOs, all C-suite level people, management committee level people, they have to pay specific attention to the well-being of their employees. If it is not on their high agenda, if it is not in their strategic plan, perhaps it is time to pay attention to this. Now, the second statistic is rather discomforting. The second statistic pertains to whether organizations have a formal well-being strategy. The private sector, more than 50%, 53% actually, they did not have a strategy for employees' well-being or well-being at work. In 36% of the public sector organizations, there was no such strategy. And unfortunately, in more than 60% of the non-profits organization, it's surprising, but also unfortunate. More than 60% of the non-profits organization, they did not have a strategy on employee well-being. And in terms of whether their approach is reactive or proactive, 32% said that their approach of the private sector, 32% of the private sector said their approach was more reactive than proactive. Something has gone off, a major tragedy, a major incident or crisis has taken place, then they pay attention. Otherwise, there is no proactive approach towards understanding and managing work-life balance and employee well-being at multiple levels. Around 80% of the public sector, they had a reactive approach. And almost similar statistic was for non-profit organizations. So, ladies and gentlemen, these are disturbing statistics, and these are important statistics. We can imagine that in Pakistan, in India, and other parts of South Asia, we may have even more complex problem where there is relatively less attention paid to employees' rights and the issues of work-life balance. Look, I really need to conclude this. I have quite a few things to share with you, but let me very quickly share with you an example of a worthy example of an organization where there is a relatively holistic approach towards understanding and addressing work-life balance and employee well-being, in particular well-being. And here I would refer to Essex County Council. And Essex County Council's example I'm giving because they offer a holistic approach to well-being. And within that holistic approach, they have a clear and explicit focus on 4 dimensions of well-being. I can very quickly list those dimensions of well-being, and you in your own time can search it further. First is mental well-being. The second is physical well-being. Third is social well-being. And the fourth is financial well-being. And the Essex County Council is of the view that unless these 4 dimensions of well-being are addressed and paid attention to concurrently, it would not be possible to realize the real notion and business outcomes and benefits of well-being, not only for individuals, but also for organizations. So that is one perspective. So finally, I have to conclude these random thoughts, but let me conclude these random thoughts with something pretty interesting. Let me go to Allama Iqbal. Let me bring the Western wisdom to Eastern wisdom, and let me try to correlate that. Are there any things, for example, within Bange Dara or Bale Jibreel or Asrar-e Khudi or Rumuz-e Khudi? Unfortunately, and I'm using this word, unfortunately, that many of us, perhaps including myself, we do not understand and read and appreciate Iqbal beyond Lappe Aati Hai Dua. You see, ladies and gentlemen, Iqbal is a poet not only for Pakistan, but also for the entire world and for the generations to come. So my suggestion to you would be that for many things, if we have to understand Islamic history or history of Indian subcontinent, if we have to understand the philosophy, if we have to understand not only history and philosophy, but the approach to diversity, perhaps Iqbal offers a pretty interesting perspective, not only from South Asian perspective, but also based on Islamic wisdom. So anyway, let me share with you a couplet, in fact, a couple of couplets by Iqbal. There are 2 shares, 2 verses by Iqbal. Iqbal says in Bale Jibreel, Dilon ko, and let me invite all of you to try to correlate the dimension of well-being within these lines. So maybe this is a small task for all of you. And those of you who understand Urdu well, I'm sure that it would be pretty easy for you to understand this. So you see that once again, let me identify that well-being, according to my understanding, it has physical meaning, it has a social dimension, it has a spiritual dimension, and also it has a financial dimension. So let's listen to Iqbal. Iqbal says, Dilon ko markaze mehro wafa kar, make our hearts the seats of mercy and love. Is it not emotional and psychological well-being, ladies and gentlemen? Unless we make our hearts the centers of mercy and love and generosity and kindness, we cannot really ensure emotional and psychological well-being of our employees and our colleagues and our subordinates. And then he says, Harime kibriya se ashna kar, make them mentally cognizant of the sanctity of the divine. Harime kibriya, sanctity of the divine. But who can understand the divine unless we use our rational and mental skills, which is mental well-being? We have to be mentally fit to understand the nature of divine and the whole complex nature of the universe which has been created by the divine. And then Iqbal says, Jise nane javi bakhshi hai tune, to one who you gave modest means to live. Is it not financial well-being? Nane javi. It could be seen as a proxy for financial well-being. Use bazue Haider bhi atakar, Maula Ali Mushkil Kusha is being referred to. Is it not spiritual well-being? And then bazu is physical well-being. You see? So ladies and gentlemen, within this folk wisdom, within this Eastern wisdom, within this Islamic and South Asian wisdom, Iqbal has given us lesson in spiritual well-being, given us a lesson in financial well-being, in emotional and psychological well-being, and mental and spiritual well-being. With this, ladies and gentlemen, I offer my random and wayward thoughts on well-being in the context of workplace and organizations. But I am sure that like you, like me, you are also looking forward to many valuable studies and many valuable papers which would be presented in the next 3 hours or so. With this, I conclude my talk, and I hand it back to Dr. Gulnaz. Thank you very much.